Adelup Press Secretary Krystal, Paco-San, Agustin. Good morning, Krystal.
Hi, Chris.
Good morning, Kristen Gray.
Thanks for joining us. I guess we'll just start. First of all, what can you tell us about the status of the Adelup contact trace investigation? I know we had heard a little bit from the Gov, but obviously she's like dealing with her things, and so
Yeah, even just like the operations over there
Right.
at Adelup. I mean, earlier we heard BBMR was shut down, and that's up there at Adelup, and the governor's and now the lieutenant governor. Are you teleworking?
Well, this is the first time I've ever been able to telework in this whole pandemic, so it's kind of exciting for me, but I'm sure it'll get old really fast. Yesterday, I did go to the office. It was skeletal crew only. I was the only one, I think, in my wing, with just a few people in chambers on the opposite end of the wing. Our executive offices are closed at this time today after the news from the lieutenant governor about his positive result. So again, executive offices are closed. Yesterday we were skeletal crew. Today it will be closed. But if you do need to reach Adelup, you can still call our switchboard. They'll take a message and divert your call to where it needs to be. They'll take a message, and then if it needs to come to me, your message will get to me.
Mm-hmm. So, in terms of like testing of staff over at Adelup, has pretty much everybody been tested? Have you been tested?
So, Bree, as you know, I work closely with the Joint Information Center with the JIC, so it was really exciting for me to finally see what we've been putting on paper into practice, especially with contact tracing. So, yeah, Governor received her positive results. What was it? Monday night?
Mm-hmm.
It was Monday night. So Tuesday morning, already a short list was made of who the governor had close contacts with. Her executive secretaries were among the first. Executive security, I believe, was tested that morning. My husband and I, we were both tested later that afternoon because he also works with the lieutenant governor. We're both in close proximity of both principals. So I was told go to AMC in Minilao. I got in line. It's a drive-through first. They take your information. They take your driver's license. They ask you to park on the side of the building and wait for further instruction. A nurse will call you, ask you more questions, and have you drive up. You pull up. They pull out the big Q-tip and they basically touch your brain. It was my first time being tested for PCR, or actually my first time tested for the COVID-19, and it takes 20 seconds. The nurse was very quick about it. I videoed my husband getting it, and then he videoed me, and then what you don't see in the video is my nose starts to bleed. So I think he touched my brain. My sinuses might be extra delicate if my nose started bleeding, but it was very quick pain, worth it. About 2 hours after we tested, we got the call basically saying we both tested negative, which of course is a big relief. But with news of Lieutenant Governor testing positive, we are definitely all on guard. That is the direction for all of us at Adelup, especially those within close proximity of both principals, is to stay at home, monitor your symptoms for the next few days. Again, timing is everything for the accuracy of the test. And so maybe we tested too soon. We don't know that yet, but out of an abundance of caution, we're just going to operate via Zoom. And I think we're all pros at Zoom by now. I know the governor's a huge fan.
Yeah.
Mm-hmm. What about, John Jr. was actually supposed to be on here this morning, and when we first got the release from you about the governor testing positive, on the release it said the lieutenant governor and the acting chief of staff had also been tested and both tested negative. So I'm just wondering, how is John doing? Or can you speak to that?
I saw him briefly yesterday, very brief contact. He may be getting tested again. I'm not too sure. I haven't spoken to him this morning. They're actually going into an 8:30 meeting that I'm hoping to get on and join right after this Zoom meeting. We again, if we develop symptoms, we're all asked to stay home, monitor your symptoms. If we develop symptoms, we should go back and get tested.
What about
And
those?
go ahead.
I was going to ask, what about those that have had contact with the governor? Because on Friday, and I know we kind of spoke about this, Friday there was an event, or there were events that the governor had contact with other people, and I would think that the lieutenant governor may have had contact with people outside of Adelup.
Right. So the governor did mention that she believes that her contact tracing investigation is over, but now the lieutenant governor has just started, his contact tracing has started. So now it's kind of, it starts all over again, or maybe we tested too soon, like I said. Again, like the doctors had mentioned earlier in your show, is that we will consider how long that contact was. Was she face to face with somebody for a prolonged period of time? Were they not wearing masks? And so for myself personally, it was kind of backtracking, like, oh my gosh, who did I speak to without my mask? So maybe when I was eating. So I try to share my meals with people only in my social circle. My husband and I eat regularly together, but who else would have been possibly exposed? So the contact tracers will consider, how long was that contact? So when I did go back into the governor's calendar, I know Lieutenant Governor did disclose it. There was a swearing in on Friday, and they'll decide, what steps to take next. Thursday and Friday were determined to be the governor's highest exposure days. And so those are the days we looked at our calendar, trying to determine, okay, who does she have prolonged contact with? Start there, branch out. Now that process begins for the lieutenant governor.
Krystal,
And after, yeah?
I wanted to ask, as we look at a lot of the data with who's catching COVID, it's a lot of younger people, right? And so a lot of the medical people that we've had on in the last few weeks, they've really been stressing this message that young people aren't, invincible, that they're susceptible to catching COVID. So I wanted to ask, because, obviously we go way back with you here at KUAM, but just what was going through your mind when you found out that you were exposed and then, and getting tested and on a personal level?
Anxious. We were definitely anxious. You start thinking about your family, your friends. I was like, oh my gosh, I still live at home with my mom and dad. And I started thinking, did I expose my mom, my dad, my brother, my niece, my sister-in-law? And you start thinking, was I wearing my mask? How long did I, interact with them? There's a lot of anxiety. Fortunately, I was able to take one of those tests that, your results come in right away. I do know that some people at Adelup are still waiting for their results because we were all split up, for the purposes of making this quick and not overwhelming one particular clinic. We were all split up. So myself and my husband, we went to ANC in Manilao. I understand that some of my coworkers went to the Guam Memorial Hospital, and I know that at least one of my coworkers is still waiting for her result. I told her rejoice in the wait because that probably means you're negative, as the governor had mentioned. The positives are always the ones that get informed first, and I know that public health is working on also a way to email people their results. Yeah. But on a personal level, it is scary. Even if I am young and I consider myself fairly healthy, it's scary.
Yeah.
And like I said, it's the first time I got to see what we put into paper being practiced. The JIC, right? We're the source for all the information for what to do, what the protocols are for the COVID response. And now it was like, wow, it's actually, it's close to home now.
Mm-hmm. Yeah. And, when we heard about Adelup, I thought about you and I was like, oh my goodness, I wonder if Krystal's, is she okay? Because, you do work with the governor so closely. And then, Joseph right here, he said, we were talking about, oh my gosh, but Krystal's father, he's on the mayor's council. He's a mayor. And then, you start branching it out.
We're doing our own contact trace investigating over here.
Maybe we should hire you part-time as contact tracers. Right? There's nothing faster than the Chamorro network.
That's what I'm saying, right? I got some aunties that would make great contact tracers.
People, right? So it's a delicate balance. And so again, like the governor and Dr. Jan and Dr. Ann had mentioned, we're very grateful for the partnerships we've built with the business community, them coming forward and self-disclosing that, hey, we've had maybe possible exposure, we're shutting down, we're going to sanitize. We're grateful for their leadership.
All right, Krystal, thank you so much.
Think of all the places I frequented. I was like, oh, thank God I didn't go very far.
Right. Well, in the meantime, stay home.
Yes. And Bree, you need to get your left ear checked because he always yells, "Stay home."
I know.
All right.
I know.
Thanks, Krystal.
Thanks, Chris.
Wash your hands.
Bye.
All right. 8:40. It's the link on the